Right, so good day again, everyone. So for day class, we will be discussing probably one of the most common reason why an individual will be using an OTC preparation. That will be colds. Usually, it's due to colds, allergy, and or cough. Okay, probably one of the main reasons why we have pediatric patients in our pharmacies. So common cold. Common cold is one of the most common infectious disease of humankind. So colds afflicts most adults 2 to 4 times a year, and children 4 to 8 times a year. And the resulting hours of absenteeism from work or school have enormous economic bearings. The several viruses can cause the common cold, but rhinoviruses are by far the most common ones. That's the reason why the thing with colds is you can manage it using OTC because it's usually caused by a virus. Now, since it's caused by a virus, most often than not, it's a self-limiting disease. Okay, that's why there is no need to use antiviral drugs for these kinds of infections. Okay, because again, after a week or so, or after a few days, normally it simply subsides. Okay, it's a self-limiting disease, as I've said. Okay, oftentimes, class, when someone has colds, you just have to manage the symptoms they present, such as runny nose, probably may coughing, or there's phlegm production. However, class, there will always be a risk that even if a cold starts as a viral infection, the viral infection class could pave the way for bacterial growth, okay, leading to a bacterial infection. And normally, class, the thing that we try to look for, we look for is the presence of fever that is persistent for more than at least 2 to 3 days. Okay, normally class pag 3 days na, if a patient has already fever for more than 3 days, 3 days or more, okay, then that would probably a very good time to refer our patient to a physician for consultation and of course for prescription, most likely for antibiotics. So the common cold virus class is transmitted mainly from contact with saliva or nasal secretions of an infected person, either directly in aerosol form. So, say for example, someone sneezed, and were at you're at the receiving end of that person who sneezed. Okay, often generated by coughing or sneezing or from contaminated surfaces. So macrophage in the body, so it's an immune cell, trigger the production of cytokines, which in combination with mediators cause the symptoms of a cold. So normally class macrophage are the immune cells that tries to target the virus. Now the aftermath class would be the production or another a byproduct of macrophage being activated is the production of cytokines. Now, these cytokines class are pro-inflammatory mediators, which could, of course, lead to the production of certain inflammation, okay, causing the feeling of the coughing, okay, a difficulty in breathing. At the same time, class, it could also lead to fever. Let's say, for example, one of the cytokines produces interleukin 2, okay, which is a cytokine responsible for production of fever, and so on and so forth. Now, you have to remember, class, these symptoms are actually being produced by the body to counteract the virus. A good example, class, would be the fever. Fever is a very important symptom because the fever class makes our body uninhabitable for the virus. Usually, class, a virus could grow at temperatures of 37 degrees Celsius, which is the body temp. By raising our body temperature, okay, it makes the body uninhabitable for the virus. It prevents them from um, multiplying, okay, further. Right? So the mediator bradykinin plays a major role in causing the local symptoms such as sore throat and nasal irritation. And so that's the what do you call this? The cytokine, the major cytokine that causes the symptoms of colds. So what are the clinical manifestations? So these are things, class, that can be assessed by a pharmacist, or we can see this. Normally, the patient has runny nose. Runny nose, class, normally it's a watery pa. Okay, one of the main difference, class, would be between a viral cold from a bacterial cold would be how thick the phlegm is, how thick the secretions are. Normally, class, if it's watery, it's either viral or pwede rin namang allergic. So again, it depends. Right, so there's coughing, sneezing, itchy or sore throat, congestion, slight body aches and or mild headaches, and then mild fatigue. And these are things as we can assess as a pharmacist. So what causes, class, our common cold? As we've said, the most common cause of colds would be viruses, specifically the rhinovirus. Okay, it's transmitted to susceptible individuals either through direct contact or via aerosol particles. So it's an airborne type of virus. All right. So the primary site of inoculation is in the nasal mucosa, okay, through the conjunctiva, may be involved to a lesser extent. And then the rhinovirus tends to attach itself to the respiratory epithelium and spread locally. What are now the signs and symptoms that would trigger us to have the patient, or that would merit a doctor's referral for our patient, na hindi na pwede ang self-treatment. So normally, class, if a patient already has a fever that's 39.4 degrees Celsius or higher, that's considered already class as a high fever, high temperature fever. So obviously, class, there's something wrong na. So again, direct the patient to a physician for proper diagnosis. Okay, a fever accompanied by sweating, chills, and a cough with colored phlegm. Because, class, that could already be a symptom of tuberculosis. That's a possible symptom of tuberculosis. Okay, so again, we need a doctor's referral for this one. A doctor's diagnosis. Okay, colored phlegm, class, could be dark chocolate or bright red. Okay, that could indicate possible bleeding within the throat, and so on and so forth. Severe sinus pain. Normally, class, a severe sinus pain would manifest as facial pains. It could be under the, parang nasa, it's just under your eyes na pain, or above your eyeball. Okay, where the sinuses are located. Okay, so yun. Shortness of breath, chest pains, worsening of symptoms, concurrent underlying chronic cardiopulmonary disease. If the patient is immunocompromised, or the patient is an infant, okay, less than 9 months, or an elderly. So usually, class, when you have those kinds of signs and symptoms, then we might want to refer first our patient to a doctor. Now, let's say, class, the patient doesn't have these red flags. Okay, we can always refer, class, our patient to non-pharmacological treatment muna if they don't want to buy any medicines. But if they want to buy medicines, then we can provide them with OTC preparations for cough and cold. But if not, we can recommend them to maintain active fluid intake. Okay, have sufficient fluid intake, adequate rest, increase humidification with steamy showers or humidifiers, saline nasal sprays or drops, soothes irritated mucosal membranes and loosen encrusted mucus, saline gargles to ease the sore throat. So usually that's just warm water with salt. Okay, so that helps ease the sore throat. So tea with lemon and honey, chicken soup, hot broths. Okay, it has a soothing effect. At the same time, class, it helps loosen the mucus production. The mucus that has already been produced pala. So garlic and ginger and aromatic products such as Vicks Vapor Rub. Okay, if you watch Jokoy, right? Diba sabi niya, his mother believes that every form of disease can be treated with Vicks Vapor Rub. But of course, because that's only non-pharmacologic. So when selecting a product class for our patient, these are some things that you have to take note of. Normally, if a patient is pregnant or lactating, we usually do not recommend any drug therapy because as much as possible, class, because it might cross the placenta. However, if kailangan talaga, then we can use oxymetazoline as a topical decongestant. Okay, it's a nasal preparation. Pwede rin naman other nasal preparation that contains salometazoline and nafzoxylline. Okay? Sorry. Salometazoline and nafzoxylline should be avoided by lactating mothers. Excuse me. So, mas maganda pa rin oxymetazoline. Now, cold medication should not be given to children younger than 2 years old. So, that's pretty much what FDA kasi is saying, that we cannot give OTC preparation for children less than 2 years old, not unless they have been seen by a doctor and was prescribed those medicines. For patients who have difficulty swallowing, nasal inhalers, sprays ang ibibigay natin. For small children, we can give nasal drops, right? Because it's easier to administer. Kasi nasal drops kasi just put it in the nose, let it stay for a few minutes, rotate lang your head, tilt your head side to side to allow the nasal drop to penetrate the encrusted mucus, okay, to facilitate better breathing. If chronic condition is suspected or if duration of symptom is longer than 7 to 14 days, patients should not self-medicate because there could be some underlying cause there that requires a doctor's attention, a physician's attention. Now, since one of the main product class that we can recommend to our patient is saline drops, nasal drops, or nasal sprays, okay, you have to learn how to administer this one. Okay, so it's part of our job class as pharmacists to explain to the patient how we are to use nasal sprays, inhalers, or pump nasal sprays. For nasal sprays or pump nasal sprays class, almost the same lang naman ang administration dyan eh. Usually put the applicator in the affected nose. You can press one of your nostril, okay, para para mas tawag dito, yung force ay yung fluid hindi nilipat sa kabilang nostril agad-agad. So normally class, just press one of your nostril, put the applicator and the affected nose, affected nostril, then spray it class, then just squeeze the bottle para mag-squirt out yung fluid, yung nasal spray. At the same time class, habang nag-squirt yung contents ng nasal spray, you have to inhale, alright, to allow the nasal spray to penetrate the deeper portions of your nose. Okay, then class, repeat it on the other side of your nose kung pati yung other side of the nose is also affected. Right? Now, what about class for inhalers? Obviously, inhalers class, just put it in the nostril, in the affected part of the nose, and just inhale deeply. Now, for nasal drops class, this one's very important. The head must be tilted. Okay, usually you just tilt it at the edge of your bed. Higa ka, pwesto mo yung ulo mo sa may edge ng bed. Then class, apply the number of drops, number of nasal drops na kailangan. Okay, put it in the affected nose. Then class, yung nose, yung head nyo, after ma-apply yung number of drops, just tilt it from side to side. Then let it stay for a minute or two. Okay, just to allow the fluid class to again penetrate the encrusted mucus. Okay, para matanggal yung bara ng ilong. Right? Then afterwards, apply on the other side of the nose naman. So here are examples class of preparations that we can use for colds. Okay, especially if you have congested nose. Right, so these are just examples class. So I leave this to you to study the dose and how to administer. Now for the self-care options class, again, you can take decongestants. Right, so these have limited effectiveness against colds. However, they do have an effect on the symptoms produced by your colds. So systemic decongestants class, we have the pseudoephedrine or phenylephrine. For topical, we have ephedrine, naftazoline, oxymetazoline, phenylephrine, cialometazoline. Now, zinc syrup class, tablets or lozenges are always recommended because it's a mineral that helps boost our immune system. Okay, saline nasal spray, pantanggal ng bara. You can also use saline gargles to ease sore throat. And then of course, class, very important is to increase fluid intake so that hindi ka ma-dehydrate. Remember class, if a patient has fever, it's important that they take lots of fluids to prevent dehydration. So here's the treatment algorithm, okay, for managing cold, treating cold symptoms. Okay, this one's actually quite easy class. I can leave this for you guys to study na lang. Okay, pero say for example, if a patient has fever, what are the things that we can do? Select antipyretics like paracetamol, NSAIDs, and so on and so forth. So again, class, this treatment algorithm, I leave this to you guys to study. So what are the expected patient outcomes? So a successful treatment class would mean that the symptoms will resolve on their own, okay, in 7 to 14 days. Dapat mawala yung symptoms nila. Okay, targeted non-prescription therapy have relieved the patient's cold symptoms, and there should be lessening of the severity of the symptoms. Now, if nagbigay na tayo ng OTC preparation and still okay, patient does not recover, then obviously class, we need to seek medical attention, right? Or if the patient is experiencing worsening condition, there's shortness of breath, there's neck pain or fever, okay, then again, that could indicate class, it's a possibility that it could be due to bacterial infection, especially if there's fever. So we will require the patient to visit a physician. All right? Okay. What about class allergic rhinitis? Okay, it's a condition wherein it's almost similar to a cold. Okay, but of course it's caused by something else. So allergic rhinitis class is a systemic disease with prominent nasal symptoms. It's a worldwide problem that affects adults and children alike. In the U.S., annual direct costs and indirect costs are estimated to be $2 to $5 billion. So an estimate of $1 billion is spent annually on non-prescription allergy or sinus medications in the U.S. alone. Symptoms of allergic rhinitis class generally begins after the second year of life, and the disease is prevalent in children and adults ages 18 to 64 years old. Normally, after age 65, the number of cases decreases. So, what happens, class, when you have allergic rhinitis? It's usually due to an allergic reaction. So, the allergic reaction that underlies allergic rhinitis results from the subsequent exposure to an allergen, meaning there's something that causes you to get the allergic rhinitis, okay, to which sensitization has occurred. So for example, allergic rhinitis is a symptomatic disorder of the nose induced by immunoglobulins E, IgE, okay, of the nasal membranes in response to an allergen exposure. Now, what are the common allergens? It could be in the form of pollen, okay, it could be dusts, all right, and so on and so forth. So marami pwede maging triggers for your allergic rhinitis. Now, what's the clinical symptoms? Normally, class symptoms could be sneezing, nasal itching. Normally, watery eyes, red eyes are classic signs of allergic rhinitis, sore throat, or hoarse voice. And these are things that we can assess as a pharmacist. Now, what causes allergic rhinitis then? It's usually caused by nasal reaction to small airborne particles called allergens. So the allergic reaction is characterized by activation of two types of inflammatory cells. So this one includes mast cells and basophils. These are both granular cells, class. And if you can still remember in your immunotherapy, immunology, okay, di ba class, ang granular cells are the ones that produce cytokines, which are are the ones that causes usually allergic reactions such as inflammation, yun na nga, mucus production, and so on and so forth. So these cells produce inflammatory substances such as histamine, which causes fluid to build up in the nasal tissues, leading to congestion, itching, sneezing, and runny nose. So allergen class can come from pollens from trees, grasses, and weeds, as well as spores from fungi and molds, dust mites, cockroaches, animal dander, and so on and so forth. So what would be the red flags that we need to watch out for? Okay, that would merit a doctor's referral. So, first would be a severe or unacceptable side effects of treatment. Second, moderate to severe persistent allergic rhinitis or unresponsive to treatment. And then, class, if the patients are producing symptoms of non-allergic rhinitis, otitis media, meaning normally pwede kasi umakyat. If you remember, class, we have one tube that connects your nose, mouth, and ear, called that the eustachian tube. So, if your nasal drip goes to your ear, it could provide a place, class, where bacteria can grow, so leading to the production of otitis media, sinusitis, pneumonia, asthma, and bronchitis. So these are things that would merit doctor's referral. Especially may sipon na tao, sumasakit yung tenga. Okay, so hindi natin pwedeng i-treat yun na tayo-tayo lang. Kailangan niya ng doctor's referral. So for the non-pharmacologic treatment, class, it's very easy. Simply avoid the allergens. Okay, that's the primary measure that you need to address. So if, say for example, dust mites ang trigger mo, then make sure that your beddings are always clean. Okay, animal dander, make sure you don't have a pet at home. Or kung sakaling may pet man, medyo malayo-layo siya sa bahay ninyo. Okay? Stuff like that. Now, in terms of product selection guidelines, so you have to consider the patient factors and preferences. So based on side effects, say for example, brompheniramine, chlorpheniramine, diphenhydramine, these are drugs that can cause sedation. So if a patient is, say for example, a driver or is active at day, so we don't recommend them to take these medications. Instead, class, we go for the non-drowsy ones or the less sedating ones such as loratadine, desloratadine, levocetirizine, and so on and so forth. Okay? Yun nga lang, mas mahal talaga yung non-sedating. Now, what about class for pregnant women with allergic rhinitis? Cromolyn nasal sprays, class, have been shown to be safe for pregnant use. So antihistamines such as chlorpheniramine, loratadine, or cetirizine are the antihistamines of choice during pregnancy. So another one, class, would be the use of nasal sprays. So we've already explained this. Okay, let's proceed na lang here. And here are some of the medications that can be used, anti-allergies, okay, that can be used for, usually these are antihistamines, can be used for allergic rhinitis. So again, I leave this to you guys to study on. So for self-care options, we have allergen avoidance. Okay, normally, nasal irrigation or saline sprays. Use of antihistamines to alleviate itchiness, sneezing, and runny nose. Decongestants, such as pseudoephedrine or phenylephrine, are usually combined with antihistamines and oral over-the-counter drugs. And cromolyn sodium class. I don't think we have this, pero it's very useful, especially for congested nose. It's used 3 to 4 times a day, preferably before symptoms have even begun. And here's the treatment algorithm for allergic rhinitis. So again, class, very important is to avoid the triggers. But if not, then obviously, class, we can start using certain medicines. Okay, depending on the symptoms being produced. Right, so again, I leave this to you guys to study. So what are the outcomes that we expect from the treatment using OTC preparation? There should be relief within 3 to 4 days. Okay, complete relief of symptoms in 2 to 4 weeks. Okay, and the patient shouldn't have had any problems or severe side effects due to the treatment. Now, a patient will need a doctor's referral if the patient who does not achieve relief or do not respond to the non-prescription therapy. Okay, patients who develop signs or symptoms of secondary bacterial infections such as a thick nasal secretions that are not clear, fever, may fever na, shortness of breath, chest congestion, and wheezing, or worsening of symptoms due to treatment. Right? Okay, and then lastly, class, we have cough. Right? Cough is an important defensive respiratory reflex with potentially adverse physical and psychological consequences, as well as economic impact. Okay? Cough is the most common symptoms for which patients seek medical care. Actually, kahit lalo sa mga bata. Okay? For pediatric patients, class, if you work in a pharmacy, most often than not, class, you'll find parents there buying medications for their children's cough. Okay, it has been estimated that Americans spend several $billion annually on non-prescription cough and cold medications. Normally, if you have a cough, it could be due to a cold. Right? So, what is a cough? Normally, class, it's a defense mechanism of the body. Normally, kasi pag nagkakaroon ng build-up of phlegm in the throat, okay, it triggers your cough reflex to remove that. Okay? So, cough is a protective physiologic reflex that augments mucociliary clearance of airway secretions. So, cough reflex is characterized by the generation of a high intrathoracic pressure against closed glottis. Okay? So, followed by forceful expulsion of air and secretions on the glottic opening. Again, because the main purpose of your cough is to remove the excess secretions. So, what are the clinical manifestations? So there is that can be assessed by a pharmacist. So usually there's hoarseness in the voice. Okay, parang lumalalim yung boses. Excessive perspiration. Okay, exhaustion and musculoskeletal pain. Usually sa side, sa tagiliran. Sumasakit na yung tagiliran nila kakaubo. Less common symptoms would include cough syncope, meaning pag inuubo siya para silang nahihilo. There's dizziness. Cardiac dysrhythmias, headache, inguinal herniation. Yan yung pinaka-worst case scenario na pwede mangyari, magkaroon ng herniation sa lakas ng pag-ubo mo. Or gastroesophageal reflex. So, what causes coughing? Normally, class, it's due to a postnasal drip. Postnasal drip, class, is the sensation you have whenever you have, say, for example, a runny nose. Then you feel, class, a fluid flowing to the back of your throat. Okay? Normally, class, a postnasal drip happens when you have allergic rhinitis or when you have colds. Okay? Excuse me. Kaya nga, class, kaakibat kadalasan ng colds ang cough. So the postnasal drip, class, occurs when secretions from the nose drips or flows back into the back of the throat. Now, these secretions can irritate the throat, causing the trigger or causing your cough reflex to be activated. Another possible cause of coughing would be asthma. So asthma is the most second frequent cause of chronic coughs in adults and is the leading cause in children. So, di ba kasi pag hirap huminga, parang naninikip, yung lalamunan, so nata-trigger yung cough reflex. And then the last one, class, would be acid reflux. Oftentimes, class, if a patient has GERD, okay, minsan nadadiagnose sila ng may chronic cough. Na minsan na may misdiagnose as primary complex or tuberculosis. Pero yun pala, yung coughing niya is not because of tuberculosis, but most likely due to acid reflux. Kasi siyempre pag umakyat, class, yung acid, it could irritate your throat, causing the activation of your cough reflex. So signs and symptoms includes severe headache, difficulty in breathing, persistent cough, stuffy or runny nose, sore throat, heartburn. These are the things that would require a doctor's referral. So for the non-pharmacologic treatment, so similar to the similar to your cold, patient needs to be well hydrated. Okay. Another one is the use of a demulcent or something that can soothe your throat, such as honey. So honey is a common home remedy, but should not be given to children under 1 year of age, owing risk of botulism. Kasi sometimes kasi botulinum toxin can stay in your honey. Humidifiers increase the amount of moisture in inspired air. So it helps loosen the crusty mucus in your nose. In short, yung bara sa ilong natin. So demulcents are water, increased fluid intake or use of vaporizer, hard candy, lemon, honey, menthol camphor, or simple syrup coats the mucous membranes and makes it less likely to be irritated. And then lastly, class would be the use of anesthetic, lozenges, gargles, or sprays containing benzocaine, lidocaine, benzyl alcohol, or phenyl numb cough receptors. So when selecting products class, you should again base it on patient factors or special populations. So based on patient factors, codeine or dextromethorphan are the drug of choice for non-productive cough. Dextromethorphan class works as a general public. Really works well. Codeine kasi requires an S2. So for us pharmacists, we can't really recommend codeine. Guaifenesin is okay? Ayun pala. So wala palang codeine na available na ngayon sa market. So guaifenesin naman is indicated for patients with productive cough. Right? Because it's a mucolytic drug. So for the elderly naman, people can be particularly susceptible to problems with non-prescription cough remedies. So another consideration is if the patient is pregnant, okay, or is nursing. So there's risk. So caution must always be used when giving medicine to children. Now, when administering class certain medicines like topical antitussives, okay, ointments and creams, remember to rub on the throat and chest as a thick layer. Huwag niyong, may iba kasi class na naalala ko dati, some parents, okay, what they do is they put the Vicks Vaporub sa throat ng children nila. So, of course, kasi never do that. Alright? Normally, kasi it's a topical treatment. Okay, so ipapahid mo lang yung rub sa labas ng throat and then sa chest to help loosen the phlegm. Okay, and provides a soothing effect. Okay? Excuse me. So application may be repeated up to 3 times daily. Now for lozenge, allow lozenge to dissolve slowly in the mouth. Huwag kakagatin as much as possible because you want it to slowly dissolve. Repeat hourly or as needed or as directed by healthcare provider. And then for inhalation class, using cold water, solution plus water, place the mixture in a vaporizer. Okay, then breathe in the medical vapors up to 3 times a day. Now, if placed in medical chamber or of hot steam vaporizer, so place water in vaporizer, place solution in chamber, and breathe in the medicated vapors up to 3 times daily. So here are some of the preparations that we have. Again, class yung dosing, max dose, okay, for specific population groups. Again, kasi codeine, wala sa atin to. Right? And we don't use this anymore. So for self-care options, we have demulcents, yun na nga, expectorants, such as guaifenesins, carbocysteine pala, yung ating mucolytic, guaifenesin would be expectorant. Okay, antitussive natin would be dextromethorphan. Antihistamines, these agents dry secretions to reduce sputum production and expand the bronchial air passages. And then sympathomimetic decongestants. So these products can reduce nasopharyngeal edema and postnasal drip. Then for central suppressants, we have robitussin or dextromethorphan. So again, class, here are the treatment algorithm, okay, on how you should manage cough and colds. So again, I'll leave this to you guys to study. Madali lang naman to. Kaya yung aralin itong by yourself. So as to patient outcomes, how will I know if the treatment is working? So there is reduction of symptoms of the cough, relief of cough after 7 days, and cough persists but has improved with continued therapy. Those people will need medical referral if there's already worsening of the cough, development of new symptoms, and illicit symptoms of chronic underlying disease associated with cough, such as asthma, COPD, bronchitis, or congestive heart failure. Right? Okay, so that's pretty much the last slide that we have for cough, colds, and allergic rhinitis. So again, class, I hope you learned something new. And yeah, good luck sa exam natin. Sa ating ano. Okay, so thank you very much and good day everyone.